Do you know someone with mental illness? With schizophrenia? This podcast is to provide a holistic and medical view to create a community and support for family members, loved ones, and caregivers of individuals who are coping with schizophrenia. Hope on the Other Side of the Door was created by Dr. Campos, MD, to fulfill his mission of creating a balanced and respectful life for those caregivers of individuals with schizophrenia internationally. Welcome to Hope on the Other Side of the Door with your host, Dr. Ken Campos.
Hello, and welcome to another episode of our podcast. This is your host, Dr. Ken Campos. This podcast series aims to be informative, helpful, and also a community-building space for those living with schizophrenia, and especially for their caregivers. Hope on the Other Side of the Door. In today's session, I'll be talking about one additional thought or explanation for the cause of psychosis. Briefly, as a quick review, psychosis is the hallmark of the diagnosis of schizophrenia. And schizophrenia is a mental illness, or formally a disorder. Schizophrenia is a collection of signs and symptoms, but not a clearly defined disease state in the medical sense of the word disease. But it is a disorder, and it is real. The research continues, yet in the meantime, schizophrenia is a major global condition, and it affects many patients and families around the world. Again, psychosis is a word for 5 different things. It is like the word fever in that it describes something very real. But that word does not tell you the cause of the fever, or in our case, the cause of the psychosis. The 5 parts are hallucinations, delusions, disorganized speech and thought, disorganized behavior, and 5th and lastly, psychotic negativism. The hallucinations could be in any one of the 5 physical senses, and the psychotic negativism refers to the absence of things. That is, missing speech or mutism, missing regular facial expressions, or having a blank face, expressions that don't match one's emotional state, or missing self-care, the absence of bathing and grooming. For the disorder of schizophrenia, one needs psychosis for at least 6 months, a notable function in their ability to work at their regular work or role in life, no known medical disease that causes psychosis, and no known medication or street drugs that could cause psychosis. There are a number of associated features which are not a part of the diagnosis, and there are some social and occupational problems which are present in the lives of many, but not all, folks with schizophrenia. Suicide is a prominent associated feature, and there are some who complete suicides as well. This makes the social impact of the condition known as schizophrenia a major world health priority. At the end of the website, drkencampos.com, there is a little educational free report in a PDF format available for describing psychosis, and also tells how psychiatrists make the diagnosis of that disorder. Next, I would like to introduce the concept of adverse childhood experiences. These are called ACEs by medical doctors, the mental health field, psychologists, and counselors. It was first identified in the 1980s at a Kaiser weight control or obesity clinic in San Diego, California. Earlier in my life, I had the privilege of hearing a ground rounds medical presentation back in the 1990s from the doctor who brought his work to clinical attention, Dr. Filiti. He's also found on YouTube talking about this. The research has grown a lot since that time. ACEs, or adverse childhood experiences, are things that happen in a child's life that are potentially traumatic. These traumas, these events, these experiences may have a negative, long-lasting effect on a person's bodily health, his or her mental and emotional well-being as well. Some of these traumas or experiences or things or events range from physical, emotional, or sexual abuse on the one hand, to parental divorce or a parent or guardian going to jail or prison. Basically, the main list of 10 primary things or events that have been studied, and this list includes the following 10 items: physical abuse, sexual abuse, emotional abuse, physical neglect, emotional neglect, exposure to domestic violence, household substance abuse, household mental illness, parental separation or divorce, and the incarceration of a household member. To say a little bit more about a few of these adverse exposures or traumas, there are questionnaires, paper and pencil tools, or interviews used to assess the ACEs. The physical abuse question covers items such as being pushed, slapped, or grabbed by a parent or an adult in the household where you were a child or an early teenager. The person is also asked if something were thrown at him or her, and then it was asked if they were ever hit so hard that there were marks or bruises left, or whether the person was injured. Additionally, one is asked if he or she was ever threatened for over a few minutes of time with a gun or a knife. Next, regarding parental separation, loss or divorce, and incarceration of a household member, this element or two elements includes the premature death of a parent, the divorce, which could be an amicable divorce or a full of anger and resentment divorce, or a divorce full of lots of negative emotion. Also, there's the case of losing a parent in wartime. Criminal behavior on the part of a parent or a brother or another family member resulting in jail time or prison time is one of these traumatic events. And it could be without any contact or any letters with the absent family member or parent who's having a time in lockup. Simply having them incarcerated is 1 point on this ACE scale. Another scenario here could be an older sibling, say a brother, for example, who was involved in street gang activity with an illegal street gang, and he may have ended up in prison. Next, looking at emotional abuse, some examples are, as you look at, or the investigator or clinician looks at the childhood of the person involved, there could be things like feeling unloved, feeling unsupported, made to feel that he or she was unimportant. There could be a lack of closeness in the family, a feeling that the family members did not look out for each other. Other questions, as you search for ACEs, involve whether the person was frequently or very often humiliated or insulted or put down. These are very serious issues for children and young teenagers. Sexual abuse can range from the inappropriate touching or fondling by a sibling that is 5 years older, or by an adult family member, or by another adult who's not a family member. And you would ask whether or not the person was made as a child to touch the perpetrator in a sexual manner. At the far end of the spectrum, there's either oral, anal, or vaginal sexual activity with the child and the adult person or the older sibling. This can be a difficult area to examine because of so many social and cultural taboos. This can also result in secrecy and hiding the truth. So this particular ACE may be a big secret, and it is possible for self-deception on the part of one parent or adult to pretend that this has not happened to the child in the household. There's also the association between adverse childhood experiences and physical illness, such as adulthood chronic illnesses, and this has been well established in the last 30 years. However, the epidemiological association between psychosis and the ACEs, the severe mental illness aspect we're talking about today, has been controversial, and it was doubted in some circles for about 20 years. Finally, around 2012, there was a well-researched study conducted. This was a meta-analysis, which has been referenced by other researchers over 1,000 times, and the researchers gave an answer that was very clear. The meta-analysis was rigorously designed and executed, and it looked at other sound research which were in peer-reviewed journals and whose methodologies were sound themselves. The studies examined looked at a variety of groups of people and of several traumatic events that were grouped together rather than just one alone. The score on the as above was 1 point for each type of ACE prior to age 18. And typically, the total number of scores or adverse childhood events is the thing that's thought to be meaningful. The higher it is, the worse outcome on physical and mental experiences and on psychosis. This 2012 study was published in the Schizophrenia Bulletin, and you can see the listing in the links in the program notes. This Schizophrenia Bulletin study reported a strong epidemiological association with long-lasting problems in adulthood. Both the maltreatment of children and household dysfunction were risk factors for these problems, including psychosis. The main problem areas are really in two arenas: adult high-risk behaviors and physical ill health. The high-risk behaviors include things like cigarette smoking, drug abuse, sexual promiscuity, and severe obesity. The ill health medical problems include depression, heart disease, cancer, chronic lung disease, and an overall shortened lifespan. The higher the ACE score, the greater the risk. As a quick example, an ACE score of 4 with regard to alcoholism shows a 7-fold increase in those that had the 4 versus those that have no ACEs, but who have alcoholism. Emphysema shows a 4-fold increase or doubling of the risk of cancer. Dramatically, an ACE of 6 or more correlates with a 30-fold increase in attempted suicide. This is not completed suicide, just suicide attempters. Now, turning our attention back to psychosis, which is our main topic, schizophrenia being the hallmark illness that has psychosis in it, just recall that psychosis is a brain condition, and like fever, it is usually time-limited. This multinational paper from 2012 was a careful review and analysis of other research. There were prospective studies, large population-based cross-sectional studies, and case-controlled studies. The reports and studies were from a variety of nations, mostly European, and from the United States and Canada, but some were from Japan and Korea, also from Israel and Australia. The studies were screened by 2 or 3 researchers and include over 27,000 articles that were screened and yielded 41 articles that were included in the meta-analysis. They used some well-established mathematics and epidemiological rules and came up with an odds ratio that showed a clear association between ACEs and psychosis. Their odds ratio value was 2.8. And the odds ratio, just to quickly go over that, is defined as the ratio between 2 things. It's the ratio of the likelihood that an event will occur compared to the likelihood that the event will not occur. In both cases, there is an outcome, but one case has the exposure to something and the other case does not have that exposure. So in our example, the event is the appearance of psychosis, psychotic signs and symptoms, and the exposure is the exposure to adverse childhood events or no exposure to those events. Again, the outcome is psychosis, and the odds ratio gives a sense of the magnitude of the power of the exposure to the thing with the outcome. The punchline is the ratio is 2.8, almost a 3-fold increase in the appearance of psychosis in folks exposed to adverse childhood experiences compared to those without. The result was that all types of ACEs, the adverse childhood experiences, are associated with an increase in psychosis or psychotic symptoms. There are some fine-tuning research issues still under question, but the main result is very clear. Even studies using a variety of different methods and association techniques showed this association clearly. Most of the studies looked at hallucinations and delusions. Those are the false beliefs. They did not look so much at the other parts of psychosis that we mentioned above. Lastly, for today's podcast, what do we do about this? When your loved one is in the acute psychiatric hospital with his or her first or an early episode of psychosis, here is some advice. Be honest with yourself, the mental health professionals involved in your loved one's care, and stay involved in treatment planning as much as possible. There is a thing called trauma-informed care. And the trauma-informed care or treatment is a professionally organized structure and framework that includes several factors and areas. There is an understanding and a recognition of the effects of all types of trauma. This model of care involves physical, mental health, and emotional safety of the people involved. Those people include the main person suffering with the psychosis, the family members, and the care providers themselves. After that, the next goal is to help the trauma survivor or the person experiencing psychosis to get and to build or to rebuild a sense of control and empowerment. This topic of trauma-informed care will be the topic of a future podcast as well. Thank you and farewell, kind listeners. This concludes episode number 29 of Hope on the Other Side of the Door.
Thank you for listening and joining Dr. Ken Campos on Hope on the Other Side of the Door. Dr. Ken Campos wants to hear from you. If you have a suggestion or a recommendation of topics or guests, please reach out to Dr. Ken Campos via LinkedIn. Hope on the Other Side of the Door is a passion and non-profit project to help caregivers to give them a voice, a community, and provide support. Please share this show if you know of anyone who might be supported, knowing they are not alone. Thank you for listening to Hope on the Other Side of the Door.